Hello, everybody. Welcome back to Dermcast TV. It's Rob Casquejo here in my hometown, Scottsdale, Arizona, and we are here today with the lovely Ilanit Samuels.
Hi.
Physician assistant from Miami, Florida. Well, welcome. This is your first time in Dermcast TV, as I understand it, right?
Thanks. Hi.
And is this your first time as part of faculty for SDPA as well?
Actually, no. I've been faculty for SDPA for a few years. Mm-hmm. I've also been faculty at the New Wave conference.
New Wave in Florida?
Yep, the Florida chapter of SDPA.
Great, mm-hmm. That's awesome. Well, we're excited to have you. You've already done an entire day of lectures in the pre-conference track under Cosmetics. This is really your baby. This is what you do. This is what you're good at, which is exciting. Yeah, and I know there's a lot of our SDPA members, even PAs, NPs, injectors in general, that are always looking for pointers and tips on what to do. So tell us about your background, where you are, who you work with, etc.
Born and raised in Miami, Florida, and I went to Bayer University for PA school, and I've been working with Dr. Leslie Baumann for over 10 years now, who's a world-renowned.
Dr. Leslie Baumann is a big hitter, heavy hitter in cosmetics. World-renowned, multiple publications, published research, the whole bit. That
Absolutely.
Is unbelievable that you've had the opportunity to work with such a renowned physician.
Very lucky, very fortunate. So I've been working with her for over 10 years, and I serve as her medical director at the Baumann Cosmetic and Research Institute.
Medical director, mm-hmm. That is fantastic. So when did you start with Dr. Baumann? You said about 10 years ago?
Yeah, about in 2009.
Okay.
Yeah,
well, so it's been a while.
It's been a while.
That's fantastic. So your lectures focused on multiple aspects of cosmetics and evaluation, treatment tips, etc. And I know you have this experience across the entire spectrum of cosmetics. So injectables, let's say. We know that we have a lot of products these days, some newer things that we've seen in the last few years, and in particular Deoxycolic Acid. This is something you lectured on yesterday at length. So tell us, give us a synopsis of the treatment as you see it, where you like to use it.
Deoxycolic acid is a biosalt, actually. And what biosalts do is they emulsify fat in our intestines. So they had this great idea of, let's take something that breaks up fat in our intestines and kind of like take it and inject it in places to break up fat in other places in our body. So it's kind of like this brilliant idea. And the only FDA approved in the US deoxycolic acid is Kybella, which is owned by Allergan. And it's a wonderful product. We use this a ton in our practice. It's currently FDA approved for submental fullness, which is kind of like that turkey neck that we see. It can be very like hereditary. We see that a lot, especially in men. And but off-label, I'm using it almost on everywhere in the body to do a little bit of like body contouring, if you will.
That's exciting.
Yeah.
So there have been things in the past that have used for that kind of treatment, even injectables, but they were really sort of outside the box and often left field, not necessarily researched. But This is one that has
approved,
an on-label
safety.
On-label
efficacy.
Indication, right. And there's some good post-marketing experience now with Kybella. Tell us about pitfalls with Kybella. Where do you find you might have some problems in injecting? So
probably one of the most challenging things that I find with Kybella is the downtime you can get with swelling, particularly when you are treating the submental area. Other places on the body that I've injected, I don't really see a lot of swelling. It's more bruising, and that's easy to hide under your clothes. So really swelling is the biggest issue. But I find that if I communicate that with my patients and I just kind of warn them, I think that's really important. So they can kind of look at their calendar and plan it out and know that for about, the first 5 days is probably the worst of the swelling. But I usually tell them to block out 2 weeks in their calendar where they don't have any big events, they're not going to be photographed for anything, that they can kind of lay low. It's kind of gotten around that. Another way that I've kind of dealt with that issue is the way I present it to my patients. So I explain to them that what's happening is the Kybella is actually breaking down and exploding the cell membranes of the fat cells. So that's what the swelling is. It's the explosion of your fat cells just blowing up. So that's awesome. It's really exciting. So when you see that swelling, that means it's working and you should get really excited. So I think that when I kind of word it that way and present it to them that way, when they see the swelling, they're encouraged by it and they're prepared for it. So they're not as upset. It's just an issue of kind of looking on their calendar and scheduling it appropriately.
And that's probably true for a lot of procedures we do, even
Absolutely.
in medical dermatology. Yeah. But I think that's a great way to do it instead of using words like hydrolysis and et cetera and so forth. So patients, they come looking for this kind of thing. Tell me one thing that you really like to do with Kybella.
I love using it off-label, I gotta say. So there's many people will have little pockets of fat that no matter how much they work out and diet, they just can't get rid of it. Or they've done liposuction or done other, fat reduction procedures, and they're still left with these pocketing areas of fat, or even waving that we see after they've done procedures or liposuction. So I can go in there with Kybella and I just kind of focus on those areas, and it just gets rid of all the fat.
That's fantastic.
Yeah.
And in the cosmetic setting, there's not many problems that really top the list like fat problems, cellulite,
fat and wrinkles.
Yeah, fat and wrinkles, they're right up there, 1 and 2. I'm working on mine. I'm trying to, they're coming slowly. Well, that's exciting. So you have a very supportive approach to explaining this treatment to patients. Mm-hmm. So how do you actually introduce the conversation? How do you introduce what it involves to do the treatment?
That can also be very challenging because it's very hard to tell your patient, you want to do something about that turkey neck that you have. So you don't want to offend them for sure. Mm-hmm. So there's different words and ways that I kind of try to work it into the conversation. You can say something like, oh, there's this great new product out there that's FDA approved that helps shrink your fat. Have you heard about it? There's been lots of papers on it, commercials. There are ways that you can talk about it that way. Right. Signage is huge. So you can talk to your reps and they can, have some signage in your waiting room or in your treatment rooms. So that way, when they walk into the room, they're reading up about it, or they ask and they say, what's that all about? And then you're able to engage them in that way. Specifically though, in our practice, what I do is I have patients fill out a questionnaire before I even go into the room. And one of the questions on there, in addition to asking them about any current medications that they're on, if they're breastfeeding or nursing, there's also a section that asks them, what issues would you like to discuss with your provider? And we list them. Things like wrinkles around my eyes or skin tightening procedures. And one of them there is, areas of fat or fat fullness in my face. So if they check that off, I already kind of have the permission to then bring it up to them. And what we do is we have those questionnaires up on a TV screen, a flat screen, in our treatment rooms. Mm-hmm. So we have it already up on a screen in our treatment rooms. So I kind of am looking up at it and going through it. And that way I'm able to kind of bring up the topic, which they're actually bringing up to me first.
I think that's really smart. This is an important lesson, I think, even in dermatology. We sometimes don't know, we can elicit problems if we prompt the right questions, something that might actually really be bothering the patient, and they don't understand that there might even be something they can do about it. So I think that's very important. We do similar in our practice for cosmetic and medical problems. For instance, hyperhidrosis, it's not something people might mention, but if you ask the question, it might prompt them into seeking a viable treatment option.
I think also just building relationships with your patients. They feel very comfortable with me. They tell me a lot about their personal problems, especially in cosmetics, we see that a lot. I kind of feel like it's a good thing I have my bachelor's degree in psychology.
Oh, hey.
that comes in there.
Dermatology is at least 50% psychology.
Absolutely.
Yeah.
So I feel like there's a rapport and there's a trust. So they're not embarrassed very often to kind of bring up these subjects and things that bother them.
That's great. I hear you. I can't even tell you. My barber gets an earful when I'm sitting there getting my hair chopped. I know how you feel. Well, that's great. That's fantastic. So injectables are definitely in your repertoire, and we know there's a lot of things you can do with fillers. We know what their on-label indications. So the subject I think people really like to hear about, both patients and injectors, clinicians, are lips.
Yes.
So this is one of your specialties.
It is. I'm known as the Lip Lady of Miami.
The Lip Lady of Miami. You have an Instagram page for that?
I
I'll
do.
Look it up. Okay, everybody
follow
look
me.
it up.
At Lip Lady of Miami.
I like hashtag plug. Well, that's fantastic. So tell us a little bit about your experience in cosmetic lip correction. What do you like to do, products, etc.?
Yeah, so I think I really got known for lips about 8 years ago when things kind of got out of control and people were starting to kind of overfill lips and look very unnatural. And I think my patients really appreciated the fact that I was really going for a subtle look and a very natural augmentation. And people started calling my office, and I have a very difficult first name. So people were calling and they couldn't say my name, but they were saying, oh, can we get an appointment with that lip lady, the girl that does the lips?
Hey, the trademark's working.
Right?
That's what you want.
I say my patients named me.
Yeah, that's right.
And that's definitely my specialty. I love lips. They can be the most complicated. When we're doing injectables on the face, I always say that the two sides of your face, they're sisters. They're not necessarily exactly the same, but the two sides of your lips, they're identical sisters, and they have to be exactly the same. And the slightest asymmetry can be very noticeable. So that's why lips, they're really advanced, and it's a really something that can be hard for some people to master. So I really am passionate about it.
You're right. I think that is it's not as simple as just injecting stuff into someone's lip. I can tell you in my own cosmetic experience, you have people who come in who have experienced it before, and so I tend to feel them out. Like, what were you told? How were you evaluated? And it shocks me how little pre-treatment evaluation was involved in their treatment.
Right.
And so I spend a lot of time counseling people, and this is why we do what we do. This is what I'd like to do to your lips.
Absolutely.
Tell me about your pre-treatment evaluation with patients.
So very often I ask them to bring in old pictures of themselves when I'm, injecting a more mature patient with an older lip. So I ask them to bring in pictures of when they were younger and what their lip looked like, so I can try to kind of match it to what it was when they were younger. I also ask them to bring newspaper or magazine clippings. Nowadays, social media, so they just pull out their phone and go on Instagram and they're like, I want her lips. So I'm able to gauge what their expectations are. So I think that's the most challenging thing, is your goals might be very different than your patients, and what they're expecting might be different than what you want to do. So it's important to have that conversation and know what their expectations are, and you can also manage those expectations, because very often they want me to build a lip that I might not feel comfortable doing, or I might not feel is aesthetically pleasing, that I wouldn't want my name on that. So definitely it's a discussion. And I'm very much a conservative injector. So someone who wants really, really full lips, I might not be the right person for them as their provider.
You are making me feel so good, and because you're validating the way I approach it myself. That really makes me feel good. I feel exactly the same way in terms of approaching particularly lips, because there's a lot of social pressure on what society thinks maybe it might look like versus a medical approach and evaluation.
Absolutely.
And I tell folks that I spend as much time talking people out of things as I do into things, and that's sort of my approach as well. That's fantastic.
So I also serve as a trainer for injectables for companies like Allergan and Galderma. And when I'm going into a training, my one take-home message, specifically when it comes to lips, is it's okay to say no. And know when to say no. And you can turn patients away, and that's okay. And it could be a hard thing to do because they really can twist your arm sometimes, but know when to say no and know that it's okay to say no.
I think that is definitely very important, and a good segue, because what I'd like to know from you, and I think a lot of our viewers would like to know from you as an expert lip injector, if you were to pick maybe two things that help you in terms of injecting a lip, making it look the way you want, what are two things maybe that help guide you? I
would say the first thing is aseptic technique. I think in order to get a good outcome, you have to make sure that you are treating and injecting in an environment that's the safest for the patient. And I think that's where people miss the boat a lot.
I agree. And so let me ask you specifically, what do you do in terms of your aseptic technique? How do you prep? Let me ask you specifically how you prep them.
So, growing up, our moms used to always say the best form of cleaning is just soap and water. So the very first thing, before I will even go into a patient room, they have their hair back in a headband, pulled back, and they've washed their face with soap and water. Usually I have a foaming cleanser in the room for them to use because I want something that's really going to take off all their makeup and all their junk that's off their face, because I'm going to be poking holes and injecting. So I want to make sure that everything's really clean. After we apply numbing cream, and when we take the numbing cream off, we re-cleanse them with some sort of antiseptic. In my opinion, I don't really feel that just using those little tiny alcohol swabs that you tear off is enough, and there's a lot of papers that talk about this as well. Research shows that you really need to do something more than that. So a lot of people are using chlorhexidine, Hibiclens. In our office, since we are concerned about drying out the skin, we've always used a product made of colloidal silver, which is a bactericide. Yes.
Yeah, it brings me back to my ER days.
Wounds and burns.
Yeah, they use Silvadene on everything in the ER. My goodness. Yeah, it's like the Windex of topical.
Yeah.
You know, the movie My Big Fat Greek Wedding, you spray the Windex on everything. Pop culture reference.
Yeah, but the driving point is, like, it doesn't matter what you use. You have to use something that's really going to kill the bacteria on the face. Otherwise, you can seed bacteria. If they're wearing makeup, you can seed that in deep into their skin, and then we can see issues later on.
Absolutely, absolutely. PrEP, I think, very important. It is a bedside procedure like anything else that we do. So, as a second point, or maybe anything that you think in terms of a product that you choose, where do you make your decisions?
Yeah, so I get asked this question a lot, right? As the lip lady, everyone's like, "Oh, what's your favorite lip filler?" And I really can't really answer that. I will say that it's really going to depend on what I'm trying to achieve and what the needs of the patients are. So let's say somebody has like a very thin lip where I have to evert the lip and really build structure. I probably will pick up one product that has maybe a higher G prime. And if someone is just coming for a very slight augmentation, already has full lips, but just wants like a little bit more of a pout, I probably would pick like a different product that's very soft. So it's really just gonna depend on the needs of the patients and the rheology of the product. And that's why it's really important to know how all the products work, how they're made, and their different properties, so you're able to then choose the correct product for the correct need. Right. I will say also that I actually love the fact that there's so many different products on the market. I feel like as an artist, right, because what we're doing is very artistic, you want to have a lot of different colors and a lot of different paintbrushes on your palette. Exactly. Right, yeah. It's really nice that we have so many. Right now in the US market, I think there's about 12 to 14 approved hyaluronic acid fillers. In Europe, there's only over 300. Yeah. And they're all coming here. Right. And it's going to get really overwhelming if people are already overwhelmed. Right. So it's important to know the science and how, the structures of each one of these products, so you'll know how to use them. Which is great, because this is the kind of things that you talked about in your lectures. And this is, as an organization, the SDPA offers these types of lectures just to give people access to this kind of information. Let me ask you one last thing about fillers. Okay. One of the biggest pitfalls all injectors know is to cause a vessel occlusion, arterial occlusion. Do you have any pointers on avoiding that problem? Yes. Know your anatomy. Dr. Surik, who was just here, he always says the fear of injecting is the fear of anatomy. And it's very important to be well-versed on anatomy, so you'll know what depths that are safe zones and what depths are not in specific areas of the face. And so for every area of the face, that's going to be different. The structures are going to be different. And if you go in there blind, then you're going to get in trouble. I agree. The other thing I will also say is have an action plan in place, because no matter how great you are, I always say it's not a matter of if, it's a matter of when. When you're doing this enough, if you're injecting enough, it's going to happen one day. And the most important thing is to be prepared. So have an action plan in place, have it written out, have some sort of protocol, because it's going to be hard to think straight when this is happening. So you're able to kind of refer to it and know what to do. That's great advice. But it has to be immediate. Great advice. Let me ask you one, do you have a reference you like in terms of anatomy, cosmetic injection anatomy, or references for anatomy? Do you have one that you like? Well, Dr. Surik has a really great anatomy book. So that's one that you can look into. I believe they sell it on Amazon. Great, fantastic. Yeah. So we've talked about some of these treatments that are very staple in cosmetic practice, something newer like Kybella. So what's in the future? What's coming? What's out there? I know we've already had a new neurotoxin in the last couple of years. What's out there? I know Dr. Baumann
as well as Dr. Leslie Baumann, who you work with, and your institution is involved with publishing a lot of clinical research, well renowned for these kinds of things. So what's coming? Tell us, fill us in.
Yeah,
what's
there's
out there?
so many great fillers coming down the pipeline. There's some that are going to be specific for jawline, chin, lips. There's lots that are really great, and I'm really excited to use and try. With neurotoxins, as you said, there's one already at Jeuveau, new on the market, and there's lots of new ones that are, I think, going to come in the future. Another product that it's expected to hit the US market this coming year is Daxi, and it's a neurotoxin that's expected to be approved for a little bit of a longer time period than the ones we already have on the market. And the technology and the way it's formulated is a little bit different. So that's going to be really interesting to have sort of a longer acting toxin,
wow,
as well as a shorter acting toxin.
Okay, that makes sense.
Yeah. Bonti. It's going to be a botulinum toxin type E. That's going to have a much shorter onset, so it's going to kick in a little bit quicker, and a shorter duration. So let's say somebody's a little bit scared to try neurotoxins for whatever reason, or you're not sure how well they're going to like it or how it's going to look. You're able to kind of give them this newer toxin with a shorter duration to have them kind of try it out. It's kind of like a test drive.
That is kind of cool. It actually and it reminds me of something else in my ER critical care days, a Brevi block when you want, sort of rapid ramping down of tachycardia scenarios. I'm having some weird ER flashbacks here. That is exciting stuff. You're gonna show it to me, right? You're gonna come and tell us all about it, right? Once the research is done.
Once it's FDA approved, we can talk about it. Yeah. But there's some papers out there that are ready that you can read and look up to kind of know what's coming. The great thing about it also is it's going to be great for people who have events that forgot to come 2 weeks ago to get their.
Got to get it in there quick, right?
Exactly. Yeah. So if it has an onset of like 24 hours, right? It's going to kick in 24 hours. That's great because if they have a party this weekend and it's already Thursday, this is something that you can offer them that'll kick in real quick.
Wow, that is really interesting stuff. That is so cool.
Yeah.
Well, I'm coming down to Miami. I'm going to hang out with you. You got to show me good food, nightlife, and then you got to show me all your tricks. This is exciting stuff.
I'm so happy to do that.
Eli, it's so cool to have you here in the
Thanks
studio.
For having me.
Yeah, absolutely. We hope to see you again. You'll be here all week hanging out.
Yeah, absolutely.
Right. That's fantastic. Thanks so much for your time. It's so great to sit and catch up with you, get to know you a little bit. Thanks again, everybody, for watching Dermcast TV. It's Rob Casquejo with our friend Eli from Miami, Dr. Baumann's office. That is really cool. Say the name of the practice one more time.
The Baumann Cosmetic and Research Institute.
You heard it here at Dermcast TV. Thanks for watching.